Many couples dream of starting a family, and for some, the journey to conception feels straightforward. But for others, it can be a path filled with unexpected twists and turns. Understanding the female reproductive system is key to navigating these challenges successfully. Blocked fallopian tubes significantly affect fertility because they prevent the egg and sperm from meeting for fertilization, and they also block the fertilized egg from traveling to the uterus. This essentially creates a physical barrier to natural conception. Think of your fallopian tubes as delicate pathways, like tiny highways, connecting your ovaries to your uterus. Each month, an egg is released from an ovary and ideally travels down one of these tubes. If sperm are present, fertilization usually occurs within the fallopian tube. After fertilization, the newly formed embryo continues its journey down the tube to implant in the uterus. When these tubes are blocked, either partially or completely, this crucial journey cannot happen. Blockages often result from scar tissue or inflammation. Common culprits include previous infections, especially pelvic inflammatory disease, which can be caused by untreated sexually transmitted infections like chlamydia or gonorrhea. Endometriosis, where uterine-like tissue grows outside the uterus, can also cause blockages and scarring around the tubes. Past abdominal or pelvic surgeries, such as for appendicitis or cesarean sections, can sometimes lead to scar tissue formation that impacts the fallopian tubes. Blockages can affect one tube, which is unilateral, or both tubes, which is bilateral, with bilateral blockages posing a greater challenge to natural conception. If you are experiencing difficulty conceiving, your doctor may recommend tests to check your fallopian tubes. A common test is a hysterosalpingogram, often called an HSG, which uses X-rays and a special dye to see if the tubes are open. Sometimes, a sonohysterogram, using saline and ultrasound, can provide additional information. In some cases, a minimally invasive surgical procedure called a laparoscopy might be performed to directly visualize and potentially repair the tubes. Depending on the cause and severity of the blockage, treatment options can range from surgical procedures to clear the tubes, if possible, to in vitro fertilization, which bypasses the fallopian tubes entirely. One specific type of blockage is called a hydrosalpinx. This occurs when a fallopian tube becomes blocked and fills with fluid, causing it to swell. This fluid can be toxic to an embryo and can even flow back into the uterus, potentially interfering with implantation even if you pursue in vitro fertilization. Recognizing and addressing a hydrosalpinx is a key step for many seeking fertility treatment. While discovering blocked fallopian tubes can be disheartening, it is important to remember that it is a common and treatable cause of infertility. By understanding the role of your fallopian tubes, undergoing appropriate diagnostic tests, and exploring the available treatment pathways with your fertility specialist, you can confidently move forward towards achieving your dream of building a family. There are many successful options available today.